everybody, Dr. Dusty here of Mattingly Chiropractic. So today I'm going to go over some data with you regarding chiropractic and carpal tunnel syndrome. All right, first let's go over some definitions. The first definition is carpal, which is Latin for wrist. And the wrist is made up of 8 bones, and that would be in this area. All right, then you have the tunnel, which is the passageway, and the tunnel is made up of the bones of the wrist and the ligament. So we have the ligament here and then the bones on the back side. So through this carpal tunnel, you have 9 tendons that go through it and what is called the median nerve. All right, so the red thing represents the median nerve, and the green dots are the ligaments that go to your fingers, all right? Now, the third definition is syndrome, which is a group of symptoms. Now, in carpal tunnel syndrome, you can have many symptoms to include numbness and tingling in the wrist and hand. You can have weakness or loss of grip strength, where you can't pick up things very well. You can have burning sensations. The hand can fall asleep, so you feel like you have to shake it to wake it up. You can wake up at night with numbness and tingling and burning sensations. Decreased ability to feel sensations in your wrist and hand, like cold and hot, and you just can't feel things. Swelling, where the fingers will feel swollen. All right, so those are the symptoms in the condition called carpal tunnel syndrome, and this is not a complete list of all the symptoms, but these are the major ones that a person can get. Another thing also, I guess, is dropsies. So a person just drops things. You know, they pick something up and they just drop it. That is a major symptom in carpal tunnel syndrome. All right, so now let's go over the next item, causes. So I wrote down some things regarding causes. First cause can be repetitive use of the wrist and hand. Second cause could be falls on an outstretched hand, so you fall down and you fall on your wrist and hand and you create a condition where you injure the wrist itself. Whiplash injuries of the cervical spine or the neck can cause carpal tunnel syndrome. Injuries to the shoulder, injuries to the elbow can cause carpal tunnel syndrome. Bad ergonomics at your workstation or bad ergonomics at your couch when you're laying on your couch, in your car, etc. So there can be very many things that can cause carpal tunnel syndrome. All right, so let's just go over a little bit on ergonomics. Ergo means work, and nomics is the management of a household. So ergonomics is the actual study of people's efficiency as it relates to the environment that they're interacting with. So it's basically kind of how you work and interact with your environment. In this case, like your workstation or your couch or your car, how you're interacting with your computer, and so on and so forth. All right, so one of the major underlying causes of carpal tunnel syndrome is basically a pinched nerve in your neck. There can also be pinching in your shoulder, like at the thoracic outlet, elbow pinched nerves, and wrist pinched nerves, all right? So basically, the big cause is a pinched nerve. Now, over here, I've drawn a little diagram of the wrist. So here you have the tunnel, you have the ligament that comes across, you have the bones that are in the backside. The major thing that is done by the medical community is to cut this ligament right here, all right? And by cutting this ligament, it theoretically opens up the tunnel through which this nerve travels through. So the red thing is the nerve. So the median nerve goes to this area of your wrist and hand. So if we track this back, we can take it right through the wrist bones, into the muscles of the forearm, right into the elbow, and into the shoulder, and into the neck. So there are many areas through which a person can get some carpal tunnel syndrome occurrences, all right? So in chiropractic, what we're gonna do is evaluate this whole area, starting from the neck, the shoulder, the elbow, the muscles, and the wrist and hand, and actually treat those areas to resolve the problem that's occurring here. It's kind of funny, I've drew this because when patients come in to my office, they've got so much attention on this wrist and hand, and it almost to them is like this is the area that's the problem. And this is almost forgotten as a primary area of really where the problem is arising. So we're going to look at the wrist and hand. We're going to look at the muscles and the elbow and the shoulder and the neck. We're going to treat that with pressure point therapy and chiropractic adjustments. All right? So now, if you're having some of these problems, it's time to get evaluated by a chiropractor before you actually do the surgery. Or maybe some of you have already had the surgery and still have the carpal tunnel syndrome, or it actually came back once again and started giving you these symptoms. All right, so it's time to come into the office and get an evaluation and see if we can actually help you with chiropractic care and pressure point therapy. All right. Okay, so there you go. Look forward to seeing you in the office. My contact data is below. Give us a call. We can help you feel better through natural ways with chiropractic adjustments and pressure point therapy and some good vitamins that help with this condition. All right, see you soon.